TV on this Fox Fursday.
Yeah, our four-legged friends can't tell us how they're feeling, so pet owners, you need to know the signs. Let's take a closer look. Caitlin, how you doing?
Hi, thank you, Q and Karen. Yeah, that's right. It is Fox Fursday, and today we're talking about eye health in our dogs. I have Dr. Martha Lowe here. She's a veterinary ophthalmologist. Big word, but an important word. Thank you for being here, Martha.
Thank you.
And I also have Corporal Brian Golder. You are here with the Lower Makefield Police Department with Jasmine. Now, Jasmine is adorable, but can you tell us exactly what she does and why she needs to see so well?
She's a 9-year-old Belgian Malinois who's trained in explosive scent, tracking and apprehension, and also part of the Bucks County SWAT team.
Okay, so she needs to have good vision for this,
Exactly.
as do all of our animals. We want them all to have some good vision. There's some video right there of her. So, Dr. Lowe, tell us a little bit about what you do and what we should be looking for in our pets' eyes.
So I think the most important thing for pet owners to know is that many ocular diseases can progress very fast and cause blindness in our pet patients. So if they're taking a look at their animals at home and they notice any sort of squinting, redness, cloudiness of the eyes, discharge, vision changes for sure, or if their pets are uncomfortable pawing at their eyes, things like that, they should definitely see their veterinarian or a veterinary ophthalmologist so we can take a look at them and accurately diagnose them and treat them quickly.
And how would dogs like Jasmine herself come down with these conditions or acquire these diseases?
A lot of them can be inherited, especially in our purebred dogs. But there's other things such as infected ulcers or trauma, or especially in a dog like Jasmine who's out running around doing important things. There's lots of things that can end up flying into her eyes and stuff like
Well, that's true, too. We saw some video earlier. So, Brian, tell me, what would be a normal day for Jasmine? What types of things is she doing where there's the debris that could possibly affect her eyes?
A lot of times we'll go tracking, looking for missing children, or searching for suspects in the woods.
Sure.
Where she might catch it on a branch or a rose bush or something like that.
And that could come up any day for any of our pets. Okay, so tell me what you brought here, Dr. Lowe. Are these what you would use to try to look at our pets' eyes?
These were things that we used to look at, an ophthalmologist would use to look at a pet's patient's eyes. The indirect ophthalmoscope helps us look at the back of their eyes, things like the retina, optic nerve, the structures that are crucial for vision. The slit lamp has built-in magnification, and that allows us to look at the eyelids, the cornea, iris, lens, look for stuff like cataracts or weird eyelashes that could cause problems in the future.
So is it kind of like when you and I go to the eye doctor and you have the same test and you're sitting there and sometimes it's like the puff of air in your eye?
Yes.
And it can be kind of uncomfortable. Okay, so you do some of these similar things. I want to get back to the things that pet owners should be looking for. You mentioned earlier some of the cloudiness or them pawing at their eyes. Are these some of the classic symptoms? Can we go through them again?
Yeah, so unfortunately, the eye can only do so many things when it's irritated. So a lot of the eye diseases will look the same in our pet patients. So squinting, redness, discharge, those can be things like an infected ulcer. If you think about it, when you get something stuck in your eye, you're kind of tearing and squinting, things like that. That's the only thing that they can show us, that they hurt.
Yes.
So signs like squinting or pawing at them mean that it's uncomfortable and it hurts. So those are things that definitely should be looked at.
Yeah.
Cloudiness, haziness can all cause vision problems. Things like cataracts cause cloudiness, glaucoma, looks like sort of a white film over their eye.
Sure.
And those things can be permanent blinding very quickly.
Okay, so all very important things that we should be looking at as pet owners. Now, tell me a little bit about where you work at CARES, the clinic. You're open 24 hours, is that correct?
Yep, CARES is open 24 hours. They're an
Good to know.
emergency specialty hospital. The emergency services are all the time, and we have specialists there 6 days a week.
And you're located in Langhorne, right?
Yep.
Okay, and one of the few 24-hour emergency centers. So thank you so much, Dr. Lowe. Brian and Jasmine, thank you so much for joining us here today. Very important information. We certainly do appreciate it. So pay attention to your pet's eyes, too.